I'm Arif Albulushi. I was born and raised in Muscat, Oman. I went to medical school in Cork, Ireland, after which I did my internship and basic specialty training in Cork and Dublin, Ireland. Then I moved back to Oman, where I did 4 years of training in internal medicine at the Oman Medical Specialty Board. In 2016, I moved to the United States, where I did my general cardiology fellowship for 3 years, and then I did another extra year in advanced heart failure and transplant cardiology. All were done here at the University of Nebraska Medical Center. When I was growing up, I always wanted to become a physician to help people and help their sufferings. Another reason made me chose to become a physician is specifically with my parents. They were both diagnosed with 2 different cardiac conditions, and in which they had to have multiple visits to the hospital, see physicians, cardiologists, get into different procedures. So I come to close proximity of being with them, seeing the environment, how they deal, how they treat those people, how they make them feel better and give them the right treatment. I became a cardiologist because I do believe cardiology is one of the most interesting field of internal medicine, and specifically the specialty of advanced heart failure and transplant cardiology. It's very fascinating, it's challenging. You deal with a group of very sick patients who require immediate and urgent attention, who've been suffering from conditions like cardiogenic shock, requiring some sort of mechanical circulatory support, whether they're temporary, like in a balloon pump or Impella or an ECMO, or even more lasting. Nowadays we have similar to LVAD. I also like the challenges and then the field that we deal with patients who have transplanted heart, and then how to deal with the immunosuppressants, deal with the complication that might arise with that. I felt this is sort of challenging. It's fascinating, and I really enjoy it. Being in an academic institute is very stimulating for physicians. You get to apply the most up-to-date recommendations and guidelines in your daily practice, and this is a way that you would improve the care of the patients, and as well as further the medical educations, which ultimately help in better quality of care.